true or false? Cardio is better than strength training for weight loss.
False.
What's the most underrated benefit of resistance training, especially in women in midlife?
The mental benefits, absolutely.
One muscle building myth you hear all the time, especially for women.
Um, I'm gonna get bulky and I'm gonna look like a man. You will not.
Is it ever too late to start resistance training in men or women?
Never ever.
Thank you. What's the biggest difference between men and women on how they build and maintain muscle? One biggest difference. Hi, everyone. Welcome to another exciting episode on Hormones and Hope. This is your host, Dr. Chhaya Makhija. And today I have a storyteller for you. She's Dr. Esra Shermadou, and she's a board certified family medicine physician and obesity medicine physician. And the reason I say a storyteller because I've heard her on other platforms and she really connects with the people and the audience. And that was my sole reason to have her come to our podcast and share great insights for both men and women in the world of health. So, welcome, Dr. Sharmadou. And please tell us more about yourself, your passion, what you do, and anything fun about yourself.
Yes, thank you so much for having me. I'm so excited to be here and speak with you and your audience. So, yes, I am a board certified family medicine and obesity medicine physician, and I have a strong passion and focus on women's health, resistance training, nutrition, and just lifestyle factors and improving those so we can live our best life. So, my history with cancer has really shaped my personal journey and my medical journey as well and where I'm at career-wise today. So,
Thank you. Thank you. Dr. Esra, one more thing I wanted to, ask you or at least have you share with the audience, with our listeners and viewers about the first time I got to know you was, I was impressed with you, posting some reels on lifting really heavy. Now, people who heard our podcast and watched our YouTube videos or even follow me on Instagram, I've gotten not necessarily obsessed with it, but I've really gotten very intentional about exercise in the last 5 years. So, what about you? What inspired you? And then we can get into a rapid fire.
sounds good. Yes, and yeah, and I've seen your stuff and you are killing it. You're doing awesome. So, it's very inspiring.
Thank you. Thank you. That's coming from an expert. I'll take it.
So yeah, my journey with resistance training really started after my cancer journey. So when I was going through chemotherapy, those sessions would just leave me bedridden for days after each treatment session, and I would just be in bed just longing for movement. I just you know even just cleaning or anything, I just wanted to move, and I would get things in the mail from the Leukemia Lymphoma Society, and they were always holding runs. And so I told myself once I became healthy that I would run a marathon. And so I shortly after or when I was done with treatment, I started running and I ran a half marathon and that was fun. And then somehow, I don't know, I just got into resistance training and lifting weights. And initially it was just a lot of machines and I did some barbell exercises too. But since then, it's just really taken off. And it really I think just being in bed for so long and just not being so tired, starting moving again just really made me feel alive. And so that's something that I don't take for granted every day. I think our bodies are something special and we should take care of them and move our bodies. And it's so inspiring and just to see what we can do when you push through the limits and see what your body's capable of and you don't think that you don't think you can do something and then maybe months later or maybe the next day after you end up doing it and it's still surprising. And so definitely a passion that I've had and something that I hope I can do forever.
Yeah, it's beautiful. We had our, like my coach interview us on this podcast a few weeks ago, and she had shared her health journey and while she was getting the surgery and chemotherapy. And, because it's kind of similar in terms of the inspiration. And she had said that someone had come to her room and he had asked her, maybe a pastor, that, what is your wish today? And the only thing she said that I would want to run a marathon again. And she says, that's it. That's all I said. And that was enough to keep me moving during my chemotherapy. And within 6 months, she did her first half marathon after chemotherapy. So, you're really, and that's why people, I told you, she's a storyteller, that you're bringing about, the real meaning to being into medicine as a physician and how you can inspire many, many of us. So I'm really grateful that you're on our show today. So, Dr. Esra, we'll start with our rapid fire, which should be actually rapid fire, and then you can elaborate on anything specific that you think needs deep dive. You ready?
Okay, let's do it.
All right. So the first one is true or false, cardio is better than strength training for weight loss.
False.
What's the most underrated benefit of resistance training, especially in women in midlife?
The mental benefits, absolutely. And we can talk about that more.
Absolutely. Your favorite no equipment strength move? Anyone can start today.
Okay, so I'm going to choose two, one for upper and one for lower. So upper body, I would say push-ups, and lower body, I'm going to say squats. Both of them can be modifiable.
I hate push ups, but I still do them. So thank you. Number four, one muscle building myth you hear all the time, especially for women.
Um, I'm going to get bulky and I'm going to look like a man. You will not.
Is it ever too late to start resistance training in men or women?
Never ever.
Thank you. What's the biggest difference between men and women on how they build and maintain muscle? One biggest difference.
There really isn't a big difference between you're going to do the same exercises. You still need to progressively overload. And we can delve into this more since it's rapid fire, but there's really no significant difference.
Nice. Thank you for sharing that. So, then what's one underrated sign that your muscle health needs attention?
I would say just having random joint aches, body aches.
Thank you. So here we are with the rapid fire, and it was a lot about movement, exercise, and strength training. So, because you mentioned that you would want to elaborate on certain aspects, so please tell us that why there is not much of a difference with what men versus women are doing to lift weights. So, what works for both of them?
Yes. So both with men and women, we have to train our body. So all of the muscles we can't neglect, other muscles or certain muscles, so we're still going to train every single body with the same exercises. So women are still going to squat. They're still going to do, bench press or, with dumbbells or with the bar. You still need to train your back. So we're still training the same exercises and you train them the same exact way. The only difference would be, with testosterone, men have significantly higher levels, so maybe they're able to push a little bit more. But women actually tend to recover better than men with training. So they tend to handle volume better than men. That's something we can do a little bit more. We're a little bit stronger in that sense. But otherwise, you still need to progressively overload. So you still need to push your weights, or your reps from session to session. So that's not going to change for either. So we're still training the same muscles. We're still progressively overloading. So no significant difference with training.
There was one more rapid fire where you helped us with that myth in terms of, cardio is needed for weight loss versus strength training. So, how can, and especially you being the obesity medicine specialist, so if you are seeing your patients, how do you navigate the exercise routine or the physical activity, and what do you weigh more for the routine? Is it strength training, cardio, a balance? How do you approach it?
Yes, good question. So, number one, I think we need to meet people where they are, especially if you're starting from zero. For some people, walking might be the easiest thing for them, and it might be mentally what they're ready for. So, you have to take that with a grain of salt, or just, I guess, we really have to consider that really where they're starting from. Now, if you can progress to the next thing, I would say, starting with squats. And that's something where depending on the level, maybe you're squatting into a chair. Maybe you're holding onto a bar or something as you're, squatting yourself down. So it's very progressive, or you can modify it to any level, but you just have to tailor it to that person's level and what they're ready for. And sometimes it's hard for us to push ourselves. And so if somebody doesn't have support, they may think that, walking is the easiest thing and that's the only thing I can do. And you don't give yourself the push that you need to try other things and move on to the next step. And so that's where, having somebody, a trainer or somebody who's knowledgeable to kind of push you and encourage you to try new things. So again, it's just kind of number one, seeing where somebody is at, but then progressing them into strength training slowly. And, we start with body weight and then we can progress maybe into bands or dumbbells, because we do want to progressively overload our joints because that's where the muscle is going to come in and that's where the muscle building is at. And that's so important, not only for longevity, but also, muscle is insulin sensitive. So it's going to, take up the glucose much better than fat. And so that's going to help if you have insulin resistance. And it also is going to help increase our basal metabolic rate, which means maybe you can eat a little bit more and burn more calories just by sitting there and doing nothing. So there's so many metabolic health benefits to muscle, just from metabolism wise, but also longevity. That's what's going to help us, be active and moving as we get older. And so it's so important. So I think, monitoring somebody's fat loss versus their muscle loss and making sure that they're retaining muscle or building muscle rather than losing muscle as they lose their weight. That's very important and something that needs to be monitored when somebody's going through a weight loss journey.
Yeah, thank you. I would want to applaud. Usually I'm listening the drum roll, which I don't have a drum roll, but yes, absolutely, especially for the podcast. But this was not necessarily in depth details to cause confusion, but just the breakdown and why it's needed was very, very helpful. So tell us something, and you've shared this even on the other interviews. So you talked about cancer. You've been talking about early menopause, which is premature ovarian failure as the cause. So how is strength training a part of your recovery? And how is it transforming? Like, if people are listening and, the viewers are watching it, how is building muscle actually transforming even the mental health? Because you talked about it in the rapid fire. So what's the connection here?
So, for me personally, the resistance training or the muscle building aspect of it, and honestly, even just movement in general, a huge stress reliever for me. And it's just kind of something that I can do that I can kind of block everything else off and focus on that. And it really, it's like a dopamine release afterwards. You feel so much better. You're energetic. Your mood is significantly better. And research does show that, exercise does help with anxiety, depression, with your mood, and also stress relief. And there's so much stress out in the world. And so this is an easy way, doesn't require any medications, and it's an easy way to help release some of that stress. For me personally, like I had mentioned it, just also just moving the body, just it makes you feel happy, it makes you feel alive, and also, honestly, you build a lot of self-confidence from it, just seeing what your body can do and pushing yourself and like, "Oh my gosh, like, I can't believe I just did that." And so and you see that transform in other parts of your life too. So many, many mental benefits from it. And then physically, we talked about the importance of muscle building for longevity, but also for your metabolic health too, but also for bone health too. It increases bone density, which is important in preventing osteoporosis. And for me personally, I did develop osteopenia after my chemotherapy sessions. And so I knew that I needed to resistance train in order to help prevent that from getting worse. And also hopefully to build back what I did lose. And, thankfully I was able to do that. I was able to reverse my osteopenia from strength training. And so as we get older, again, we know that osteoporosis, especially in postmenopausal women, is a huge risk factor, especially when we get that significant decline in estrogen. And when you have osteoporosis, that's going to increase your chance of developing a fracture. And once you have a fracture, it's very hard to return to your baseline, and you have increased mortality after, a hip fracture as well. So it's so important to for bone health as well. So that's, we got the muscle, we have the bone, we have the metabolism, we got the mental aspects of it. So many benefits of resistance training and building muscle.
So, that was muscle health. You literally, we've learned recently, or we've been emphasizing like how muscle is a metabolic organ. I interviewed a cardiologist today, and how she talked about it being the longevity tool or the longevity organ. That means, with our health span and lifespan. And you covered the metabolic aspect of it, right? The insulin sensitivity, and also so important for weight loss and improving our metabolic rate, like how my machinery is working, like my engine. We could ramp it up if we are able to focus on our muscle and strength training. Here is my problem. So, patience, right? Everyone is not buying the idea. Like the patients who are ready, they come to me. They're already doing their due diligence in terms of strength training, men or women. People in general, and I see that even in family members, like distant family members, cousins, that they still don't buy into the concept of why it's important to build muscle, and it doesn't mean that they have to go to the gym, right? So if they're not ready, or say the awareness is not there, or they're not interested, but you know that you could help them, and they could start with something simple, which you talked about, bands, or just starting to walk, right? Are there any tips and tricks that you use with individuals, even if it's not patients, individuals, that encourage them to focus on muscle? Again, the squats, yes, you talked about the push-ups, two important ones that you mentioned, rapid fire. And I'm putting myself in that same group, 10 years ago. That, what is, I don't have time, or, what's the big deal? I'm going out for a walk. I enjoy my walks. So, if you can share anything in terms of experience, or what you've encountered, and help me out also, so that I could be of some service to those individuals who are not ready.
Yes, that's you make a very good point because a lot of people really do struggle with this and they don't understand, like, I go walking and that should be enough. But walking, while it's great and, there's benefits to aerobic exercise like walking and running, but so much, importance also with resistance training. And so a lot of it is gonna come down, personally, I feel like, to repetition and just trying to tell them the benefits of it, and maybe even, you know, being a little pushy with it, testing their limits and just being, "So when are you gonna start? So when are you gonna start? Okay, you don't have time? Okay, you're have something in the microwave for a minute? Okay, if you can't do full push-ups, you just lean against the stove or the counter and just kinda do push-ups from there. See how many squats you can do for that minute, and, maybe trying to even get them to do it with a family member or with you personally and seeing who can do the most squats in that minute, and, trying to get some sort of incentive in there. It is really hard because even with my family members too, I struggle, with my mom and some of my sisters, and, just trying to encourage them, and, family back home as well. It's almost like a foreign concept, and so, I agree. It is something that you have to see where somebody, again, it comes back to seeing where that person's at and what they're ready for, and just that constant repetition and that constant, a little bit of encouragement and pushiness to hopefully finally get them to come over that edge and see what it's all about, and honestly, once they get there, I think they enjoy it, but it just takes a lot to kinda get them over that edge.
Yeah, yeah. I know that's you're inspiring each other. One more aspect that's work is like building the community. And that could be just, a group of a couple of us, or just two of us. My accountability partner is my husband. And we've learned how to build into that kind of relationship where it's accountability rather than, pointing fingers or blaming, or inspiring each other, pushing each other. The second one has been the making these or creating these small groups. So with our family, we have a Fit Family Challenge on WhatsApp. With then the iMessaging group, or we have like an email group, and just posting. And of course, now we have social media platforms. But there has to be something that'll work in terms of connecting with like-mindedness, or like you said, getting into the personal trainer or coach and being open-minded to learning something new. So, yeah.
Yeah, I think, like how, there's the step counters and you can join groups with the step counts. There needs to be something made for, for strength training too, like whether it's like push-ups or I don't know, we've got to come up with something.
Yeah, yeah. Well, we could start another, the Instagram trend on push-ups, and could be any form of modified push-ups. Right.
And yeah, but community is huge and having somebody else with that accountability or just somebody to do it with, that's a huge thing that really works.
Yeah, yeah. I think we should start it since we're talking about it, Here we are all about living the talk. So,
Absolutely, yes.
all right, people, you'll see us soon doing push-ups. Mine would be modified for now, but let's do it. So yes, so that's you talked about the importance, how to start, when to start, even these 30 second snippets. What's the difference? Like, we all start getting this awareness, especially in midlife. Either we probably have some time, or, their careers have been established, and that's why we stop thinking about health, some form of symptom, concern. For males, it's the hormonal decline. For men, it's, the fatigue, or they might just think that I'm aging faster, or it's, the sense of not able to do what I was able to do at age 25, just that energy shift, right? So midlife is something that we all start really reflecting on. Oh my gosh, something just changed. It wasn't a transition. Something just shifted. So how do you coach your men and women, your patients, in terms of where to start? Is it going to be high sleep? Is it going to be my nutrition? Is it going to be, looking at weights, or, pharmacological interventions? So how do you start with them?
Yes, good question. And again, it comes to personalized care. You can't take a blanket approach to everything. Again, starting with what are they ready to do? And it's all about the small, consistent changes. It's not about transforming your life overnight. What are you ready to do? What can we push you to do? What's the next step you're ready to do? So for somebody, it might be, maybe we start with breakfast and we, add some protein to our breakfast, add some fiber to it. For somebody else, it's, maybe let's start walking 10 minutes after each meal. What are you ready for? And if somebody is like, no, I don't, I don't necessarily want to start with that. I don't have anywhere to walk. Okay, well, can you do these squats while you're waiting for your breakfast to cook up or something? So, and then if medications, if that's where they're at, okay, let's start the medications. And maybe after we start the medications and we lose some weight, we're more confident and we can go to the gym and we can do some of these things or we can start walking. So, we're all about personalized care and it's the same, like you do too. It's all about just seeing where they're at, where can we take that next step, where can we push you a little bit. So everybody's going to be a little bit different with that. Again, just coming back to that person.
Yes, so working with that person. Yes, absolutely.
Mhm. 100%.
With the muscle comes the protein, of course, the fiber. We hear different requirements. So in general, based on guidelines, we have zero point 0.8 to 1.2 grams per kilograms of protein. You're more athletic, you want to build more muscle, get more lean, then the requirements go higher. Your personal experience, and what do you share that with your patients in terms of recommendations while they're engaged in strength training?
So I think that, the zero point 0.8 to 1 gram per kilogram is a good place to start. For some people, if they are eating like 20 grams of protein a day, it's not going to happen overnight. If you try to get them to go from 20 grams to, 100 grams overnight, they're going to have a lot of GI issues. They're going to be constipated. They're going to hate it. They're like, no, I'm not doing this. So it's just going to be a gradual increase. Maybe they add 20 more grams the next day, and it's that's like a cup of yogurt. So it's not that hard to do to go overnight and, eating something like yogurt tends to go down a little bit easier. So gradual changes, but that's kind of where I start is if I can get you to that point 0.8 grams per kilogram, 1 gram per kilogram, I kind of like that area a little bit more. And, but some people love protein, others don't. So if I can get them just around that area, that's a good place to start.
Yeah, that's very nice in terms of flexibility. I heard recently with one of the longevity specialists that and the cardiologist, she's focusing on 1 gram per pound. So, if you're around, say, 150 pounds, that's aiming 150 grams of protein. But I loved what you said, gradual and individualized, it's personalized based on your needs. And you also want to see what your body's telling you. We are gut. Yeah. So that's, those are those awareness tips rather than just believing a fact, but also how is it actionable for me? And how is it going to benefit me? That's amazing. What do you have? Yeah.
I may have misspoken, but I typically go around like the gram per pound, is kind of what I do too. So I may have misspoken earlier, but
Yeah, yeah. So if you have to build muscle, exactly, I feel, yeah, it's very difficult for me to get to that. So I'm around 125 pounds, so 120 grams of protein. I'm barely able to make it to 100 grams, being a vegetarian, on most of the days if I'm very intentional.
and that's good. And also like if you're vegetarian or vegan, it's going to be a little bit harder because your protein sources still have a lot of carbs in them. But carbs are protein sparing too, so it helps protect your protein, your muscle. So that's still, and that's why we have some flexibility in that, that's why there's that point 0.8 range or, and again, meeting somebody where they are. So as long as you're kind of increasing it, that's still a good amount because if you eat meat, it's much easier to get your protein sources. So definitely flexibility is important.
Yeah, absolutely. It's that fine balance of knowing. So meats will add the fats unless it's bean. We're vegetarians, it's beans, lentils, nuts, and tofu, and different kinds of cheese, yogurt. You mentioned. So that's the complex carbs come into beans and lentils, just like you mentioned, and the fullness, like you do feel fuller sooner. So keeping that in perspective, like I can't force something.
'Cause you get a lot of fiber with those beans and the lentils and everything, that's a lot of fiber, so
Yes, yeah. So it's like a fine balance where, also knowing that I don't have to be very restricted that, oh my gosh, I didn't meet 200. But overall, in a span of 6 months, 1 year, most of the days, what am I doing? And being intentional helps, the consistency helps. So thank you for breaking this down and making it very clear in terms of how to approach it. The last one was fiber. So, the muscle, you talked about the protein of fiber. How is that playing a role in this world of, weight loss, obesity, as well as strength training?
yeah, so fiber is so important, there's so many health benefits to it. So I know a lot of people think about it related to digestive health, which is very important, but there's so much more to it too. It helps also decrease our cholesterol levels, so that's very important. It helps with our microbiome, so that's gonna help with just GI health, gut health, our digestion, our ability to tolerate certain foods, and our immune function. And there's also, a lot of research coming out with gut health and mental health too. So there's so much more that we don't know about that's related to all of that. So many important benefits of fiber. And many Americans don't reach that with a typical diet. They maybe get 10 grams, 15 grams. And general recommendation for females is about 25 grams. And for males, it's a little bit higher, 30 to 35 grams per day. And so that's, for a lot of people, that's hard to get on their typical diet. So again, it comes back to being intentional, like you mentioned about your diet and seeing what are my nutritious sources that I'm getting. Maybe there's protein here. This has some fiber. We got some healthy fats. So again, it's kind of just that well balanced diet and just knowing what it's providing you. That's so important.
Yeah, thank you. Now comes the fourth one. So I'm very intrigued because of your story. Any essential supplements, like creatine or protein powder or collagen or magnesium, electrolytes. So, what are the essentials that you think with the focus of strength training and building muscle?
Good question. Creatine, number 1, absolutely. It's one of the probably most well-studied, supplements out there. It's just plain old creatine, there's nothing else in there, and it's very important and helpful with, muscle building, and then there's a lot of research coming out now with its effects on, like, mental health and energy and different things too, so I'm excited to see where that comes out to be, but typically, you can start off with 3 to 5 grams a day and maintain that. There was like an old thing where people thought like you had to like load it for the first week or two and then go to maintenance dose, but really just kind of starting off between 3 to 5 grams and then just maintaining that is a great place to start. Now there's some research about like if you're really athletic or if you're exercising multiple times a day, you can do 10 grams. But for general people, just 5 grams a day is perfectly fine. So that's number one. I think also electrolytes, especially if you're working out in the morning or honestly, if you're working out in general, if you're sweating a lot, you need to replenish with that. So I think that is helpful. They sell them in the store, but then, there's different ways that you can make them at home too. And so that's helpful. It helps you with recovery, not necessarily, specifically for muscle building, but, maybe it gives you a little bit of oomph to go a little bit harder in the gym because you're feeling recovered and replenished. But hydration in general, also important. Omega-3 fatty acids as well. If you're not getting high fat fish sources during the week, that's important as well. Vitamin D. A lot of people don't get enough vitamin D just from the way we work. We're indoors. We're not spending time outdoors very much. So that's a good one to supplement. And then for those who have difficulty getting protein during their day, protein powders are an option as well if you can't get it from whole food sources. You just want to make sure it's like a clean sourced protein. But otherwise, I think, I would say creatine is number one. Start with that and kind of go, and then vitamin D and omega 3s. Those are probably the top three that I would recommend. And yeah, I'd start there.
Thank you. Thank you. Yeah. I also, with again, with personal experience and with patients, best ways are also if it's third party tested or NSF certified to help them because there are so many brands out there. And I really tell my patients if you're looking for a protein powder, you make sure there's no sucralose in there because many of them tend to have it in the least amount of ingredients. And of course, it's really palatable. You don't want to just use chalk powder, and make yourself miserable. Personally, what I've noticed, and I've been looking into this, like even with some of my women patients, is that creatine on days of no workouts. If and this has been like my last 1 year experience, it does make me bloated. And after eliminating all the factors, like what else can cause it, so now I've minimized it to only on days of workout. And, for individuals, like you said, personalized medicine, individualizing it. For some of the women patients, I have to make sure that I have them tweak it based on, how they're feeling and then eliminate other factors that could cause it. And same thing with men. Yeah. It's, usually they don't complain of bloating, but some of them will say that, just the stomach feels heavy or the way they describe symptoms is different well than being very specific. So, when I had to tweak it, that's been helpful. And it's been studied. It's not very, very common. And it's not that every person or every individual feels a sense of water retention or bloating. But I had to tweak it so that, I can still gain the benefits, like you said, because that's on your number one list as well. And that's truly been an important tool for me to help build muscle now.
Yes, and I was gonna mention the bloating when I first spoke about it, but I was like, No, that's okay." But yeah, that can happen, bloating can happen with people, especially when you first start it, and sometimes after a couple weeks it goes away. But like you said, if it doesn't go away, you might need to, decrease the dose a little bit, see if that works, and honestly, sometimes it's also the brand. So and there's different formulations of a creatine, some people say if you get, like, a micronized creatine, it causes less bloating, but I don't know that the research is really out there to actually say that it does. So, but yeah, playing around with the dosing can help a lot, and even like you said, like playing around with the days that you take it, that can help too because it does, it essentially kind of goes into the muscle and it pulls water in, and so it can cause some water retention for some people if you're sensitive to it. So. those are definitely good things to point out and things that you can try to help minimize it.
Yeah. Thank you, Dr. Esther. This was, I feel like, a guide to muscle strength training. That's what our episode, transformed into, which I'm very delighted about. Because I haven't had a conversation where we're really drilling down into the specifics from building muscle to how to in terms of the nutrition aspect of it. So thank you. This was very very insightful, and like I said, it's going to be a guide for so many out there. So Dr. Estra, tell us, if anyone who needs to connect with you or follow you or even become your patient in Ohio, how can they find you?
Yeah, so I am on Instagram, YouTube, TikTok, and Facebook, just Dr. Esra Shermadou, and I have we'll put the links I'm sure in the bio. And then if you're in the Dayton, Ohio area, I am opening a practice in October. So you can go to sakinahealth.com. That's SAKINAH health, HEALTH.com. And you can join our priority list. So you know that when we're accepting patients. So I'm super excited. And we're all about personalized medicine and working with you to improve your health so you can feel, more energetic, healthier, and happier. So,
Thank you. Thank you, Dr. Esra, and congratulations on your special practice where I'm pretty sure thousands and thousands of patients will come. So thank you for joining us, and we look forward to many more now motivated and inspired to get into strength training.
yes, absolutely. And we got to work on our challenge.
Yes, that's coming. Push-ups. Thank you, Dr. N.
Absolutely. All right. Thank you for having me.
Bye.